Hi, this is Dr. Brittany Todd with Sacred Heart Clinical Pharmacy Specialties, and I wanted to go over febrile seizures. They're one of the scariest things that can happen to a healthy child. Now, there are some children who have neurological deficits, neurological disease that can have seizures, but a febrile seizure is a seizure that happens in a child who does not have a history of seizures, no history of neurological disease at all. And they simply have a seizure because their fever gets so high or their fever spikes very quickly. So a couple things that can cause that, obviously infection, right? Um, and some people will think, oh, they have a fever, I'll stick them in a cold bath. Well, if you stick a child in a cold bath who already is fevering, their body's already really warm. You put them in a cold bath, it makes them shiver even more, and it actually spikes their temperature even higher. So that can cause a seizure. So do not put them in a cold bath. If anything, you can put them in a lukewarm to warm bath to cool them off, but please don't put them in a cold bath. That'll just make it worse. The other thing you want to do is make sure it's not spiking. So if you see that their fever is just creeping up and up and up and up and up and up, if it's getting close to like 102, 103, you're kind of hitting the threshold of let's just make sure we're not pushing that fever too high. And that's where the pain and fever dosing guide comes in that we have created for parents and caregivers for their children. And the unique thing about this, instead of using over-the-counter medicine dosing that you see on the acetaminophen or the ibuprofen products, is instead of giving the standard dose, let's say 5 milliliters for a 24-pound child and a 35-pound child, getting the same dose, even though they're 11 pounds difference, this will give you the exact dose based on your child's exact weight. So if you're looking at a 24-pound child, you can pull up the acetaminophen dosing chart, look for the 24-pound in the chart, and then it says that you can give anywhere from 3.5 to 5.1 milliliters of the acetaminophen suspension, which is great because you can actually choose to give the lower dose if you want to, or you can choose to give the higher dose, especially if you're kind of worried about the febrile seizure. Maybe they have a history of febrile seizures. You might want to go with the higher dose. Now, if you had a 35-pound child, the dose on the over-the-counter bottle says 5 milliliters, but the dose on here can actually go anywhere from 5 milliliters as the lowest dose, all the way up to 7.4 milliliters. So if you're worried about your child, their fevers are just going up and up and up, they have a history, you're a little bit worried, maybe give the higher dose. And this booklet gives you the tools to figure out what dose is best for your child. So again, this is the pain and fever dosing guide for infants and children. You can find it on Amazon. It's $14.99. It ships within a couple of days. It's nice to just have in your medicine cabinet just to make sure you have it when you need it.